I have much
Good
time.
afternoon, and today we have a pleasure of interviewing my friend from Greece, myofunctional orthodontist, Dr. Anastasia Vasileiou. Good afternoon, Anastasia.
Hello. Hello. Good afternoon, everybody.
We really appreciate because due to the time difference, it's actually almost night for you, right?
Yes, it is.
So thank you very much. And first of all, thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, we're going to talk about something very important, what you can change in the everyday life and hopefully make your jaw stronger and muscles tighter and hopefully snore less and sleep better. We're going to talk about chewing and how chewing and what to chew and how to chew and how that can make your life better. That's a very forgotten everyday habit. We all do that, but we don't know if we do it right or wrong. If you are a medical professional who, just like us, trying to put all little puzzles of sleep disorder, breathing together, or maybe modern lifestyle and evolution, what I write about in my book, Breathless, then this program is going to be for you. We're going to talk about very important, human activity or trait, what actually undergo full evolution through the human history. And, it's especially pleasant what Anastasia joined us from Greece, where, we can call it a cradle of evolution in a way. So let me introduce how we met with Dr. Vasilieu. We met at Mewing conference in London, and it was so pleasant to find serendipity with people around the world, like Anastasia. She's doing very similar practice, but on the other side of the Atlantic Ocean. And she's a dentist and myofunctional orthodontist. She changed the way we look or the way the teeth position, but also she addressed function in the same time. But also she combined the body work with fascia and neuromuscular re-education of the body to support the orthodontic work. And she's also creator of anti-gravity system. That's for people who really, just like me, so much into the facial aesthetic. And anti-gravity system, it's a holistic therapeutic method what combines myofunctional therapy, functional orthodontic, and targeting breathing technique and a tongue posture training. I love it. And lifestyle coaching, we're talking about sleep, posture, stress, and nutrition. And also, her clinical work focus on temporomandibular joint and snoring, sleep disorder breathing, mouth breathing, facial symmetry, all topics so close to my heart. And she trained internationally through online programs. And also she does in-person training in beautiful Greece. And we just talk about that in the blue zone, in the zones when people live longer. And she collaborates with dentists and orthodontists and other health professionals. And also she's an author of the book, you can see it on the screen, called Return to Function, Chewing as a Forgotten Superpower. And she explained the chewing, tongue posture, breathing, how it shaped our face and overall vitality. And I'm going to ask you, Anastasia, what exactly means what chewing our forgotten superpower? How we can start chewing and how soon changes appear. By last thing I want to mention, in Russia, when I was in medical school, studied dentistry in Russia, we pay a lot of attention to chewing. It was a difficult efficacy testing, how chewing worked, but in my American education stage or my American career, we don't do that. So tell us how we can start chewing conscientiously and how soon changes appear.
Well, it is something that you can learn and make the neuroplasticity move your body again and quickly in a new position. So how soon, it depends of how often you do that. in your daily life. And but it is something that you can find out changes very soon. But I cannot really say a time for somebody. For everybody is not the same. It depends of um, how much you do present of the day, and that will show very quickly.
But can you talk about how chewing actually influence airway and sleep, and what daily practice can someone start tonight to reduce snoring and mouth breathing? If you can talk about your, system anti-gravity.
Mhm. Yes, well, anti-gravity system corrects the forces and saves the face. Corrects the forces, which are the chewing, the swallowing, and the breathing. These are movements, and we do I mean, we live with breathing, actually, and we are doing it like 30,000 times per day. If you do something for 30,000 times per day wrong, it writes, because that's what happened with me. I entered that field after I see dysfunction behind orthodontic problems, and you cannot you cannot have good results only with orthodontics if you leave the disorders how it was before, showing that actually form follows function, as I found out very soon in my practice, from noticing people how they look and why they were looking like that. I'm trying to find a very nice picture I have with the pterygoidean muscles of the mastication. And one picture sometimes explains everything. It is 1,000 words, they say. Um, but until then, I will speak about. Oh, oops. Sorry. You give me one moment to find out. Yeah, there it is. Um, you can see them, those muscles
Yes?
inside, and those when they are working symmetrical, bilateral, with a good um, posture of the whole body and the feet. Because when I teach people, I teach how to work all the body, not only the muscles of the tongue or the face. Everything is collaborating. And when we meet next time in your group, I was with a New Yorker, a physiotherapist from New York,
Mm-hmm.
and he said that very nice. I don't remember his name. Sorry. We chew with our feet and we walk with our eyes. And he was in the room with me, and I said, "That's exactly what I say to my people. That if you want to do it right, you have to take care of the whole posture, not only the head." So, and the gravity system is little changes of the daily habits, doing it more consciously, and knowing why that affects. And then you can change your whole life, your shape, the way you not only uh, look, but how you are present in life, how you live in the moment, and you're not only consume, you are connecting.
Yeah.
And yes.
I have a question about modern diet. You talk a lot about chewing and a modern diet. change our faces. Tell me what food we should add to our diet and remove to reverse this trend. What should we eat actually, and especially pleasant, you're talking from Mediterranean, I just mentioned cradle of civilization. What, Greece recommend us to eat, or maybe
Yes.
ancient Greece?
Well, Greek diet, yes, an ancient Greek diet was a lot of depend on fruit and dry fruit also, almonds, all the um, I don't remember all the names in English, but all the
Nuts?
fruit, all the nuts, because we have many.
Yes.
Um, they are so good for chewing, and also fruits like apples. And I also have some dry, dry apples here.
Oh,
I can perform with that.
yes,
I have them as a chewable tool
yes,
for my patients. So everything that is carrots, of course, meat. Um, we don't need to be very soft
yes. I think that's very important.
because everybody's looking for soft meat. Oh, it was so soft, so nice. We don't need to be so soft. We need, I mean, chicken. If it is strong and not very chewable, it's better than the other one here because it is live outside, and so it is eating a natural what nature gives it to feed, and they taste better and they are organic. So it is better to have a chewable, strong texture of
Yes,
chicken or meat or vegetables than to prefer textures that they are soft, smooth, colored, with no vitamins. I
right.
mean, you have to choose between a healthier lifestyle input in your body and
I'm gonna ask you because we don't have it here. You have that Italian. You just show it to me. Elastomeric orthodontics. We do have myobrace. I'm big proponent of it. But show us what you use for for patients who need to have orthodontic treatment, but they cannot afford to have a clear aligners.
yes, I work with clear aligners, removable.
Mhm.
Yes, but then
Which one you use? Which clear aligner system you use?
the the it is my system. I mean,
Uh-huh.
I do the orthodontic plan,
Yes.
and I want to produce space for the tongue. I always go forward and
Wide.
yes, wide side open. Uh, I don't like stripping or everything that. I always do CBCT scan and see the bones. So sometimes the cheekbones, the maxilla needs to be forward in one side and not in the other to produce the symmetry. And I take care of the occlusion, that we have a good occlusion so we can chew properly, because occlusion, it is a problem there for many of our colleagues. They think that it needs to be in one way, but occlusion is something that you can change it, and you can change it for better. You don't need to stay in one occlusion all the time, because I think that teeth are moving in our whole life. Every day they are moving. So if you leave them to move by gravity, you will find them in a disaster, in a disorder. But if you can show them in which way to move, and move properly by a good chewing, a good posture, and everything, and in clear aligners and move them where they should be, it is a very good way to keep your face and your neck in a good symmetry and healthy, even the skin. You can tell that the fascia is it is elastic and have breathing properly, because we breathe with our skin also. Um, so yes, I use the clear aligner, and before or after I can use this.
Yeah, this system called MCOP. We don't have it in United States, but this particular material is very interesting. That's actually just came on the market. I just saw it on Greater New York Dental Meeting. This changed the shape from hot temperature. It can fit, to any shape, and then it goes to specific shape in the mouth. This elastomeric material has memory, which is very promising, I think, for dentistry.
It is, and you can change it and make space also. With hot and cold water, you can reshape it a little bit to make the jaw larger. So yes, that's the two of the tools I use for the teeth. But for the whole body, I have more, like the myomans, the tape of the lip.
Myomanchi, right? The Myomanchi. Why do you use Myomanchi? To help people chew? That was my last question. What somebody who experience anxiety, how can chewing help to regulate nervous system
Yeah,
without getting fat? Obviously, we cannot chew all day on a food. It
yeah,
might affect significantly.
it's true. But we can look. We have to figure out what chewing is. Sometimes chewing, it is such a performance that uh, you yes, burn calories. You can burn calories as well. Not only take calories from the food, but if you do it right with a strong motion, it's like you are in the gym. And that's how you structure your body, by having this idea that now you perform, and now you are doing it in a good posture. Because if you go to the gym and you drag weights in a bad posture, you're going to traumatize somewhere, you have a pain somewhere. So the same thing happens with the chewing. If you don't doing right, you traumatize a teeth, an articulation somewhere else in the body. So that's why we have headaches, and we have uh, teeth problems. One teeth has a pain, and you go and you do the root canal, and things that doesn't make sense, because you don't need to have the root canal. You need to have the teeth in a good posture. I mean, to be inside the arc and do the each job properly, chewing, because chewing is what these organs are made for. So we need to take care of those organs by knowing how to use them, and how to use them. Uh, it is like a manual, a structure manual. We have it now. I have it. I mean, I am doing a divine communication with my ancestors here, and I want you to know that before, in ancient Greece, they did know the thumb pulling that we are talking about. New Mike talks about a lot. The thumb pulling was something that they did that here in ancient Greece. We know that, and they did orthodontics by moving their teeth with their fingers and put pressure. So it is something that we can understand that our body has the ability to do, and it's not always that we need um, wires and a long time, many things to do, surgery, and I don't know how difficult can it looks like, but it's not. Imagine with a simple Invisalign, in 6 months you can change the whole occlusion. I
Yeah.
mean, this person who had a crossbite, it changed. This is number one.
Mm-hmm.
Look at this crossbite.
Yes, the molar is in a crossbite.
Yes, and after seven,
Seven aligners.
only seven steps, stages, the crossbite went.
Nice.
So, and it is a different person now, a
Of
big
course.
muscle, symmetry in his face, and he has no pain. He had several pain in his articulation, and it was a baby who was sucking his finger and did this crossbite. But you have to find out why this crossbite is there, how this person chew. He didn't know how to chew. I mean, I didn't know how to chew. I always in my whole life feeling a little bit. Uh, I couldn't go out. I didn't. I like a good restaurants and a good lifestyle, but I was very intimacy because I was like, I don't know how to chew right. Nobody in my environment did that right. My father, my mother, grandparents, grandfather, everybody had his own style, which is something that I didn't want to mimize. I saw that it is not very nice to chew like that or like that. And I was always wondering how is the well, savoir vivre says something, but it is not explaining how to chew. They say
Right.
not put the elbow in the table. Okay, because it goes the shoulder up, and that explains also that savoir vivre with myofunctional therapy, you can find some orders there that it is good for the body, but they didn't explain why it is good for the body. They didn't do it for that purpose. They did it only for socializing purpose. You did it only for the people you have close to you, not for you.
Yeah.
So everybody who knew savoir vivre, I knew. I was searching everything. They didn't. They say chew with your lips closed. Okay, but that's not enough. It's not enough to have the closed lips or your hands down off the table. You have to take care of your feet. You have to take care of uh, the the symmetry, the bites, and they're not so much. It is not so heavy ideas or knowledge, but it is something that you need to know. It,
Absolutely. That I highly recommend to my readers visit Anastasia Vasileiou's social media. She has a lot of things and valuable. And then Return to Function. Her book is on Amazon, and she's so generous with her offers. She uh, she developed a special code for listeners to my podcast, and I'm gonna put it underneath the interview. And then she offer, she has wonderful offers, including retreat in the blue zone and the longevity zone. So that's such a thank you very much, and I hope my audience gonna benefit from correct chewing. So we really appreciate your time, and I have your book, and now I start thinking about chewing, and I put a little bit of chewing in my book. So thank you very much.
well, I invite you. We can have the best projects from the clearest island in the world, and we can chew together and have training dinners and have fun and learn how to breathe, sleep, and uh, have this environment of the blue zone to live better and longer.
Thank you.
Thank